Hello and welcome. I am Mohammed Shipaf and I'm one of the academic rheumatologists from University College London.
And I'm Dr. Anthony Psaras. I'm an academic clinical lecturer in rheumatology at the University of Oxford, United Kingdom.
So this is day 2 in EULAR. Welcome everyone. Today will be a very busy but yet fascinating day in EULAR. There will be a mixture of a lot of clinical part and a lot of basic and translational research, and my colleague Anthony is going to talk through about that.
Thank you, Shipa. So first, I would like to highlight the first amazing session in the morning, which is fully dedicated to autoinflammation in space 3 between 8:30 and 10 in the morning. So the aim of this session is to describe the molecular mechanism behind autoinflammatory disorders and how these could be therapeutically targeted. And also this will help us to understand the genetic factors behind these autoinflammatory diseases and especially somatic hypermutations. And hopefully that will generate a useful discussion in the end, how these diagnostic procedures during the workup of patients with periodic fevers can be utilized in clinical practice.
This is going to be really, really fascinating because it's quite difficult field in rheumatology and it's a diverse disease and autoinflammatory conditions. So really fascinating to look forward, which make me to talk about a HPR session about the non-pharmacological management in rheumatic disease. And as you know that there are a lot of non-pharmacological interventions are coming up and they are great, they're multifaceted and they basically will show how you can improve the quality of the life and the patient's need in complex rheumatic disease. And hopefully we will also learn about how the socioeconomic condition impact in rheumatic disease and also the multimodal approach and the multidisciplinary approach of this non-pharmacological management.
Absolutely. Thank you for bringing that up, Shipa. And moving to the afternoon sessions, I'm excited, Shipa, to introduce a session fully dedicated on single-cell omics in rheumatic diseases. This is under the Basic and Translation Science topic, and it will be held in space 3 between 1:30 and 2:45. And hopefully that will give us an update on the technological advances on both genomic and transcriptomic analysis and how this can be utilized in studying autoimmune rheumatic disorders. And I'm happy to share with you that we'll have 3 amazing keynote speakers as well as 2 oral abstract presentations in that session.
That's amazing, Anthony. So mind the gap, please, mind the gap. So we'll be talking about the PARE session, and so the PARE is going to present basically their complex need the patient having you often forget to address as a physician. So how to basically mitigate that gap and improve the patient outcome, and how to basically have the decision-making process, shared care decision with the patients and understanding their needs. So this will focus on how we mitigate the importance between the shared care decision between patient and the healthcare professionals.
That's so important to understand, Shipa. And moving later to the afternoon, so let me ask you, do you know how to interpret a PET CT scan in the context of giant cell arteritis?
Not at all.
Not at all. Okay, so probably you need to attend the practical skill session.
Absolutely.
In space 4 between 3:45 and 5 o'clock, and that will hopefully give us more insights on how to classify an abnormal PET CT scan in patients with giant cell arteritis, and we'll have the chance to listen from the very experts in the field how we can use the PET CT scan in our everyday practice and facilitate diagnosis of large vessel vasculitis, and also to hear about common pitfalls, radiation risk, costs, and monitoring disease activity.
Amazing. So now we move to immunity session. The young rheumatology group is going to present about EULAR task force, so the organization of it, how it is formed, and the multidisciplinary approach, how we basically liaise with the other stakeholders like PARE, patient participants, and HPR. So this is basically going to be a really interesting session about these interrelationship and then the shared partnership. And this is going to happen in Amber Room 3 and 4 at 3:45.
Okay. Emunet always organize such good sessions.
Absolutely, yeah.
And last, what I would like to ask you is, are you good at interpreting kidney biopsies in the context of rheumatic diseases?
No, not my cup of tea.
So there is another very interesting session, and so EULAR How highlights the interplay between rheumatology and other specialties such as rheumatology. So we have an amazing session focusing on the kidney histology in systemic lupus erythematosus and vasculitis that will be held in Amber 1 and 2 between 3:45 and 5 o'clock. And that will help us to familiarize ourselves with the classification criteria, the histology types between inflammatory disease that can present as glomerulonephritis, tumbulointerstitial nephritis, and other vascular lesions in the context of rheumatic diseases. And I think this is very important to familiarize ourselves with those tools that facilitate prognostication of lupus nephritis and systemic vasculitis.
Fantastic. I will be there definitely. So now we talk about my favorite topics, inflammatory myositis, and that's going to happen in Gold Room at 4:30. So they will be talking about the recent updates about myositis, the pathology behind it, the novel aspect of it, preclinical and clinical development in inflammatory myositis. So hopefully this will be one fascinating session for us to watch out for.
Great. And of course, we need to mention the poster session in EULAR, which is the most exciting part of the conference. So don't forget to join the tours, discuss with the first authors, and engage in amazing science.
Absolutely. I often go to the poster session and I always get really, really interesting ideas and when I talk with them and give us a really interesting opportunities to network with others. And I've heard that this year's EULAR poster is going to be massively interesting. So that's all we have for day 2 in EULAR, and we are all looking forward to have this fascinating session and hope you will all enjoy.
Thank you very much. We look forward to seeing you around. This is Anthony.
Thank you very much. This is Shipa.